Hi, my name is Allyson Simpson. Today I will be informing you about juvenile rheumatoid arthritis. One of the most common chronic rheumatological diseases is juvenile rheumatoid arthritis, also known as JRA. Some people take the ability to have a healthy, free-moving body for granted when kids all around the world are getting diagnosed with JRA. Kids are having to deal with one more thing in their life that can hold them back, a thing that could keep children from playing with their friends or participating in sports. My experience is through my older sister Megan, who is now 20. She was diagnosed when she was 9 years old with arthritis in her right wrist, and now later on, when she was 14, she got diagnosed in her left knee. I have gone through many of her doctor's appointments, and I've also done plenty of my own research, and I believe that I have enough information to really show you how much I know about JRA. Today I will discuss what JRA is and how children get JRA. And I also discuss the diagnosis process and how this disease can be treated. I will first discuss what JRA is. After conducting my research article, Juvenile Rheumatoid Arthritis Basics from WebMD, JRA is an autoimmune disorder, which this means that it identifies some cells or tissues as being foreign in the body. The immune system then begins to attack healthy cells and tissue, with a result in inflammation marked by redness, heat, pain, and swelling. Stated by Kevin Magnum, it is also referred to as juvenile idiopathic arthritis. Idiopathic meaning there is unknown cause. It affects children 16 and younger. Around 5,000 children are affected in the United States. The difference between JRA and adults with RA is that JRA symptoms disappear in about half of those affected. My sister is not one of those. Symptoms may include pain, limping first thing in the morning, or also after taking naps. Swelling, often in larger joints as in the knee. Stiffness appears more clumsy. There are many tests to diagnose this disorder. There is not one specific test that confirms a diagnosis though, but there are certain tests that are completed that can rule out many of the other conditions that have similar symptoms. The book Arthritis by Madeline Anderson stated many tests. There are several blood tests consisting of the C-reactive protein, which measures the levels of general inflammation in the body, anti-nuclear antibody, which are proteins produced by the immune system in people who have autoimmune disorders, rheumatoid factor, which is an antibody commonly found in the blood of children, but with many JRA cases, no big abnormality revolves in the blood tests. My family actually realized that my sister Megan had arthritis one day when we were having a push-up contest in the living room, and she couldn't bend her right wrist. And in a few days, we had an MRI, and we discovered that her results show that she has JRA. An X-ray and an MRI may be taken to exclude other conditions like fractures, tumors, infections, and defects. Imaging may be used several other times during the diagnosis process just to rule out other bone development or joint damage. After being diagnosed with JRA, treatment can be determined on your conditions. There are all different types of medications, whether it be pill form or injected into the body, whether it is exercise or therapy, or at worst case possible, surgery. The article Juvenile Rheumatoid Arthritis as a Complex Genetic Trait, written by David Glass and Gianni Edwards, stated non-steroidal anti-inflammatory drugs, which are like ibuprofen, Aleve, and Advil, are also good pain relievers, but they're also over-the-counter. There are also disease-modifying anti-rheumatic drugs that can be prescribed by a doctor to describe to you to your pain. There are also when other drugs are not relieving the symptoms. They are used to slow the progress of JRA. An example would be methotrexate, which my sister does take, still to this day. Medication can also be injected into the body. My sister has had several cortisone shots, which they inject straight into the joint, and she also had my mom give her shots into the thigh. Physical therapy or occupational therapy is another treatment that can be recommended by doctors. They will give you exercise to continue to keep the joints flexible and maintain the range of motion. Supports and splints are also recommended to protect the joints and keep them in good motion. This is a splint that my sister wore to bed and to school. And this is also one of her exercises that she had to do, and she had to squeeze it 5 times for 20 minutes. Surgery is the last option and only if they need to improve the position of the joint. As you can see, juvenile rheumatoid arthritis is an autoimmune system disease that a lot of children get diagnosed with, something that many have doctors, appointments, and treatments to follow through. Today I have discussed that JRA is the test that diagnoses it and the treatments for this disease. As I said before, juvenile rheumatoid arthritis is one of the most chronic diseases for a child, and it has many tolls of a child's life. As I described today, this process it takes which a child can be diagnosed with JRA. Through my experience of watching my sister and all the research that I have done, I definitely feel bad for those diagnosed. When you complain about your life being difficult just because your parents won't buy you a new pair of shoes, think of all the kids who have serious diseases, because I know I definitely will.